Hi, I'm Dr. Nikitha Murthy, fertility specialist at GarbhaGudi IVF Center. In today's video, I'll be talking about one of the top 3 commonly seen cancers in our country, that is cervical cancer. This cancer is in a talk a lot nowadays because of 2 to 3 major things. One being the whole news about Poonam Pandey, an actress/model who has now faked her death because of the cervical cancer to increase awareness. The second being the union budget actually devoting and increasing out and voicing out the fact that there is an importance to raise the awareness and prevention in adolescent girls. So this is basically for the making the vaccination, that is from 9 to 14 years of age. And the third being the World Cancer Day being on February 4th. So all this is basically to increase the awareness regarding cervical cancer. 2 words, let's break it down. Cervical cancer. The first being the cervix. So what is the cervix? Basically, it is the mouth of the uterus which leads to the birth canal, that is the vagina. So there are many cells in the cervix, and basically like any other organ in our body, these cells are rapidly dividing. So these rapidly dividing cells, in case they undergo some type of change, there is some abnormality and the growth goes out of control, it develops into a cancer. So there are top few reasons because of which there is cervical cancer. So one of the most important risk factor is the HPV or the human papillomavirus. There are many strains of this human papillomavirus, and this virus is usually transmitted sexually, that is by sexual contact. So what happens that time? Most women usually have an immune system and they destroy this virus. But in a small percentage of women, what happens is that they are unable to fight this infection, and therefore this infection is there in the body for a very long time. So what happens because of that? Because of that, the cells are undergoing constant changes because of the virus, and this develops into a cancer. So HPV is one of the most important causes for developing cervical cancer. Along with this, if there is a HIV, that is AIDS infection, or if they are smoking, this rapidly goes in, forms cervical cancer. So what are the symptoms of cervical cancer? Number 1, it is very important to know that if in the early stages, usually there are no symptoms, and this is like many other cancers which are seen in the body. Number 2, if it is a very late or an advanced stage of cancer, that is when we get to see the symptoms being abnormal discharge from the cervix or bleeding from the cervix. And third being, while having sexual contact, some amount of bleeding might be seen, or just abdominal pain, that is stomach pain, might be seen. So when you go to a doctor, the patient is examined to see what type of problem is there, and then by doing an examination, that is a gynecological examination, you might suspect that this disease is. So usually it is seen in women more than 30 years of age. And the treatment for this being, if it is detected, then usually commonly it is surgery, that is to remove the part of the uterus, that is the cervix, which is affected. Along with this, the uterus might be taken out, the organs next to the cervix have to be taken out. So high doses of chemotherapy, radiotherapy, and this is like in any other cancer as well. But it is most important to understand that this is a very few cancer which can be prevented. It is preventable by a vaccine, and that is what we're going to be stressing on in today's topic. So the first being that the HPV vaccine. So there are different types of HPV vaccines which are available. This is given to women as well as men, because in men also the HPV virus can form the different types of cancers, that is the oral cancer of the mouth, that is the throat, also of the penis, anus, etc. If this HPV does not go in to cause a cancer, there are few strains of HPV which is also responsible to cause genital warts. So all this can be prevented by taking the HPV vaccine. Usually it should be taken before you are sexually active. So it is commonly given from 9 to 14 years of age. That is in the form of 2 doses. That is, if one dose is taken today, the second dose is usually taken after 6 to 12 months. If the age is more than 15, that is in women and men, it is given in the form of 3 doses. That is one given today, one after 1 to 2 months, and the other after 6 to 12 months. So because of this, most of the HPV which cause the infection, cause the cancer, warts and all that is usually taken care of, and the whole disease can be prevented as such. There is usually 98% protection by taking the vaccine. The second being routine pap smear examinations, that is after the age of 21, at least every 3 years, to detect the human papillomavirus, the HPV DNA testing along with the pap smear, that is co-testing, is done to make sure that any early stages of cancer can be found out soon and this can be treated. So it's even important to know that around 1 to 2 people out of 100 cases which are detected usually end up in death because of improper detection and because of late diagnosis and improper treatment. So that is why it's very important to get detected early, make sure you get the proper treatment and do not go to the ultimate stage, that is death. So the whole intention of making this video is basically to raise awareness regarding the cervical cancer. So share this with your loved one and let's prevent the number of deaths and number of patients who are suffering from this type of cancer. Thank you.